Carly Keeter is the Division Director for Juvenile Justice at the Policy Research Associates. Ms. Keeter is responsible for projects related to juvenile justice and behavioral health, including operation of the National Center for Mental Health and Juvenile Justice. The NCMHJJ provides a national focal point aimed at improving policies and programs for justice-involved youth with behavioral disorders. Ms. Keeter has worked for PRA since 2006, participating in research, evaluation projects, training, and technical assistance activities. Since 2011, Ms. Keeter has been the project director for a SAMHSA and MacArthur Foundation collaborative that aims to increase the number of youth with co-occurring mental and substance use disorders diverted out of the juvenile justice system. Ms. Keeter was recently involved in a multi-site evaluation of juvenile mental health courts as an alternative to traditional case processing, and an evaluation of a juvenile justice training and workforce development initiative. Ms. Keeter received her Master of Public Health from the University at Albany School of Public Health. Keith Cruz is an Associate Professor and Co-Director of the Clinical Forensic Specialization in the Department of Psychology at Fordham University. Dr. Cruz conducts research on the clinical forensic assessment of youth within the juvenile justice system. Dr. Cruz's clinical forensic practice includes providing assessment and treatment services, providing SBIRT testimony in juvenile courts, and offering technical assistance and consultation to local and state juvenile justice systems. At this time, that is all of the housekeeping I have, so I am going to turn things over to Carly and Keith.
Thank you so much, Crystal, and hello everyone, welcome. I'm so excited to be able to share with you our SBIRT and Juvenile Justice Project overview today, and really excited to hear also who's on the other end of the phone. I realized that not too many of the questions actually afforded the opportunity for juvenile justice practitioners to self-select, but I think one of the most important things, and one of the things that you'll hear a lot more about today, is really the importance of collaboration. So even though we're talking about opportunities for implementing SBIRT in juvenile justice settings, it's incredibly important for juvenile justice systems to have those community-based collaborators, those providers that they can work with and make those referrals to in order for this to be successful. So with that, I will get started and provide you with some background in terms of our SBIRT project. So this project is coordinated by the National Center for Mental Health and Juvenile Justice, which was established in 2001 at Policy Research Associates. As you heard from Crystal, our mission really is to promote systems change and improve outcomes for youth in contact with the juvenile justice system with behavioral health conditions. And there are a number of ways there on the screen for you to learn a little bit more about the National Center or to get in touch with us if you have any follow-up questions. It's also important to very much thank the Hilton Foundation who funds this project. The overall goal is to plan, pilot, and evaluate the effectiveness of using SBIRT, really to identify and respond to not only substance use, but also co-occurring mental health and traumatic stress among youth who are in contact with the justice system. This slide, I think, really provides a depiction of the stark contrast between general population youth, the prevalence of behavioral health conditions among youth in the justice system compared with youth in the general population. And as you can see, the prevalence of mental health conditions, substance use disorders, and also traumatic victimization as defined by one experience or indication of one experience of traumatic victimization is so much higher for youth who are in the juvenile justice system, which is why you'll hear how our SBIRT initiative is really focusing on taking an integrated approach to recognizing and identifying and then responding to, sorry, hold on one second. Please forgive me, I've had a little bit of a voice issue for this morning. So an integrated approach to identifying and responding to mental health, substance use, and of course traumatic victimization as well. It's also important to take into account the layout of what's happening in the field. So looking into what is happening, what has been happening, and where there are opportunities. There has been over a decade of reform through Models for Change, so a decade of juvenile justice reform that's been occurring since the mid-2000s, with enormous amounts of progress being made all across the country. There has also been a lot of, there have been enormous strides made in terms of identification of need within juvenile justice settings, so screening for mental health needs within juvenile justice settings, risk assessment, and then more recently, but I think it's also equally important to note, traumatic stress. The one thing that's not on this list, which I think probably many of you are noticing, is substance use, which is one of the opportunities that we really identified for this particular project, which is the substance use, the need for identification of substance use within juvenile justice settings. There's also been a lot that's occurred around best practice in juvenile justice settings. So again, the screening, both pre-adjudication and post-adjudication, so all across the continuum, being able to identify need and then respond to it. There's one of the pictures on the screen is the mental health screening within juvenile justice, The Next Frontier, which was published in 2007. There's been an enormous amount of work for, again, over a decade in terms of identifying opportunities for diverting kids who don't need to be in the juvenile justice system and diverting those youth to appropriate and effective community-based services. And there's an example of one of the guidebooks that was made available through Models for Change that really clearly spells out what the steps are and how different jurisdictions and juvenile justice programs can implement diversion programs. There's been a lot of work around developing and disseminating interventions and treatments that work for youth who are involved in the justice system. And then, of course, a lot around workforce development is too. So one of the things that you'll hear too as well when we're talking about the training needs among juvenile justice practitioners, one of the areas that there has been a lot of work done is dissemination of motivational interviewing training for juvenile justice practitioners. So that's not something that's new necessarily, but what is new, and where again there are a lot of opportunities for implementing SBIRT within this setting, is the brief intervention. So taking those motivational interviewing skills and really applying it to having a conversation around screening. So as you'll notice, the opportunity that we really identified for taking SBIRT and adapting it for use in juvenile justice settings was around taking this integrated approach to identification of need related to substance use, mental health, and trauma, and also an integrated approach to the identification of needs through screening, followed by an intervention or having that conversation again with the youth.
Hi there, Carly. This is Crystal. It seems like we've had some trouble with getting your computer to accept the screen share. So I am running the slides for the attendees to see. So if whenever you'd like me to advance, if you could just say next slide, I'll be sure to do that on our end.
That would be great. I saw a lot happening and I wasn't really sure. So great. If we can move on to the next slide, that would be wonderful.
Absolutely.
So while we're waiting to move on, as you can see, there's been a lot that has occurred in juvenile justice settings, but there are still a lot of opportunities in terms of where we really need to go from here and where SBIRT can really play, I think, a very important role in terms of improving juvenile justice practice and really having an impact on the youth who are coming into contact with the justice system. Crystal, I don't know if my computer's frozen, but it looks like we're still on the one slide.
Which slide is that, Carly?
Are we on the project timeline?
I have advanced it to the Phase 1 planning slide. Is that where you'd like it to be?
If we can actually go back to the project timeline, that would be great.
Sure. That is where I am.
Excellent. So the SBIRT JJ project timeline There are 3 phases. We're in the middle of the second phase currently. Phase 1 began in September of 2014, and the focus of that first phase was on gathering information so that we could plan a thoughtful pilot to evaluate Esper in the juvenile justice settings. So we were really focused on that phase, not only on gathering information about current juvenile justice practice, but also what was best practice in the area of SBIRT, and what was best area in the practice of mental health, substance use, and trauma intervention, screening and interventions. Phase 2, which began in July of 2015 and is really the essence of this project, involved the identification and selection of 9 pilot sites. And then we will be working with those sites through June of 2017 to help them implement and then evaluate this SBIRT JJ. And Phase 3, which overlaps, of course, with all of these projects, but we've really allotted 6 months towards the end of this project. It focuses on dissemination of the project results. Crystal, we can go to the next slide. So this provides a little bit more detail about Phase 1 planning, where we convened an advisory committee to answer those 4 critical questions, or those 4 areas on the screen. So we wanted them to answer critical questions about the most effective use of SBIRT, discuss implementation strategies for testing SBIRT in juvenile justice settings, help us to identify potential barriers, and then also provide us with recommendations for next steps. The advisory committee included national experts in SBIRT, screening and interventions that work within the context of kids, or with kids who are involved or in contact with the juvenile justice system. We had family members, we had youth who were involved, so we had youth voice present on the advisory committee, and of course juvenile justice system practitioners that recommended, or juvenile justice system practitioners that represented juvenile probation, juvenile court, juvenile detention, and corrections. Next slide. The conclusion of Phase 1 was summarized in this summary report, which highlights not only where we started and all of the information that we gathered, but also really set the framework for what we were going to do going forward. So identify key strategies and recommendations for going forward. And I've pulled out the 5 that really set the framework for where we're going, which is number 1, the recommendation of the advisory committee was for us to focus on those earliest points of contact, because that was where there was the most opportunity for identifying youth who had needs that may or may not be being met in the community. And there was really an opportunity there to identify those needs and then to make those connections with community-based providers and hopefully facilitate access to services for those kids. That we really needed to focus on community-based settings. So we have avoided through this project pilot testing SBIRT within the context of juvenile detention and corrections, but have focused instead on diversion, intake settings, court settings, and you'll hear a little bit more about that in a moment. The other recommendation, which is very critical, and you'll see this throughout the presentation and when Keith talks a little bit about what SBIRT JJ looks like, if you're familiar with SBIRT that's been implemented in other settings, you'll very much see best practice SBIRT within this model as well, because we thought it was critical to take best practice from SBIRT and best practice from juvenile justice settings and to really integrate those into this approach for early identification and intervention. Workforce development was identified as a key area for us to focus on, so really spending a lot of time identifying the needs for the juvenile justice workforce, where we would need to provide training and opportunities for skill building and development there. And then it's, of course, very critical to engage cross-systems partners and stakeholders, and especially when we're talking about kids, we have to talk about families. Next slide. Phase 2, which is the phase that we're currently in the middle of, is the testing and implementation phase. The first couple of months of this phase were spent developing the implementation framework that is being tested out in our 9 pilot sites. So this really is a pilot or a draft implementation guide that takes all of the information that we collected and gathered at Phase 1, recommendations from the advisory committee, and puts it down on paper so that the sites have a framework or a guide in terms of how they're going to, what they're going to implement and how they're going to go about implementing it. So this pilot implementation guide spells out what the framework is, what SBIRT JJ looks like, and provides access to resources that can support implementation of any one of the components of SBIRT JJ. We did reconvene the advisory committee last month, and the focus of that meeting was really to review and make any last-minute revisions to the implementation guide before we moved full force ahead with piloting SBIRT JJ in the sites. We also spent quite a bit of time describing what the sites look like, where we see opportunities for implementing SBIRT JJ within a variety of the different settings that had been identified by the advisory committee during that first-year meeting, and then have made those changes to the implementation guide since the meeting, have incorporated goals and needs that were identified by the pilot sites, and will be moving forward with piloting this SBIRT JJ in the settings. Next slide. I want to spend a little bit of time providing an overview about what the pilot sites are and what they look like. So the three areas that we identified as opportunities for intervention are initial contact, so that's that initial contact with the juvenile justice system by youth. The areas that we will specifically be testing out SBIRT JJ are juvenile assessment centers or drop-off centers, community agencies where law enforcement can bring youth who have been picked up for some low-level offense, very often a truancy charge, and can bring them to this juvenile assessment center so that someone can meet with the youth, screen them, identify need, and then make those referrals to community-based providers for any follow-up treatment or services or supports that are needed. We also identified intake, and these are all very fluid, but we have, based on the sites that we've identified and are working with, have spelled them out and defined them this way. So intake is defined as probation intake or juvenile diversion programs. These are very often juvenile probation departments. So they often serve as the intake or that initial contact beyond law enforcement to the juvenile justice system. And the juvenile diversion programs that we're working with are very specifically probation-operated juvenile diversion programs. So when kids have their initial intake interview, needs can be identified. Probation officers can meet with youth and families and then identify those opportunities to keep kids from really progressing deeper into the juvenile justice system. And court, we are working with a number of juvenile courts, specifically their court intake departments, which very often serve a very similar role as the probation intake and the juvenile diversion programs, but because they're based within the court setting and it's court staff that really kind of operate that intake and make the determination about where kids will be diverted to, we have separated that out. As I mentioned before, the advisory committee recommended that at this point, because there were so many more opportunities for intervention in those community-based settings and those earliest points of contact, that we focus on those. So we have not focused on post-adjudication and we have not focused on detention for this particular project. Next slide. So we are working with a number of different pilot sites that are indicated on the map. We are working with two of those initial contact sites, one in Minneapolis, Minnesota, and one in Louisiana. Those are those juvenile assessment centers that I just referenced. We're working with a number of probation intake or diversion programs, a couple in Connecticut, one which I want to mention very specifically focuses on transition age youth, so we're not specifically talking about juvenile justice, but we are talking about very young adults within the context of the justice system. And of course, another intake or diversion program in Louisiana. And then we're working with two courts in Ohio. Next slide. I'm not going to go into too much detail here, but I did want to provide for each one of the center or each one of the opportunities or intervention points, I wanted to provide a very brief picture so you can see exactly how we've gone about working with these sites and where we hope to go from here. For each one of the sites that we're working with, we've actually gone through a very extensive process of mapping out what their intake looks like. So from the point of contact with the youth, what's currently being done, who sees the youth, what screening is currently being done, how are referrals made, how are decisions made, when are parents pulled in. So we wanted to really map out exactly what was happening in each one of these settings so that we could identify where there were opportunities to implement SBIRT. And when I say implement SBIRT, it's very often augmenting, improving, sometimes replacing current screening practices that were in place, because screening's not necessarily new, but at the same time there is a very clear need for an integrated approach to identification of not only mental health needs but also substance use and traumatic stress as well. So working with those sites to map out what's currently being done and then identifying where there were opportunities for us to implement SBIRT JJ. Where we are going with these, and I think it's one of the reasons I really wanted to show some of these maps that we've drawn up, is that all of these will be made available at the end of the pilot process from all of the different sites, so that other jurisdictions that are interested in replicating this project or SBIRT JJ can really look at all the different areas where SBIRT JJ has been implemented by looking at what other systems, how they operate, where they were able to implement SBIRT JJ, and who did what, really the who did what, how they did it, how they made the referrals. So Crystal, if you want to go to the next slide. We did the same, as you can see, for intake, and these are very complicated, complex maps of what's happening. So we, as I keep saying, it was a very detailed process, really wanted to make it clear exactly what was happening, when youth were being seen, by whom, and how those follow-up referrals or how decisions were being made, so that we could, through this process, help juvenile justice practitioners make more informed decisions about how to respond to needs of youth who are coming into contact. Next slide. And this is our last one as well. So again, just really going through and identifying what's happening and where there are opportunities for us to identify need and hopefully be able to inform juvenile justice decision making. And with that, I'm going to turn it over to Keith to talk about what SBIRT JJ looks like.
That's great. Thank you, Carly. And so our SBIRT implementation plan and the overall strategy, just wanted to reinforce a couple of points that Carly has already mentioned. And that broadly, our focus here for SBIRT has really been informed by our work in implementing screenings, mental health and behavioral health screenings in juvenile justice settings, and that broader prevalence research that Carly just referenced. So, you know, the first point here is that, of course, the high rates of substance use, mental health needs, and current trauma reactions often found in juvenile justice populations reinforce the need for us to take a real integrated approach. Screenings in juvenile justice settings also need to be very brief, and they need to be guided by decision-making that is accessible and easy to use by typically non-clinically trained staff as well. Implementation, particularly in diversion sites, specifically create a really unique opportunity to try to curb further system penetration. But from our prior work with diversion programs, we also know that this creates concerns about net widening. In other words, bringing youth, screening youth, and then that the results of those screens being utilized to somehow bring them further into the juvenile justice system. Therefore, we've been working with sites to create legal protections in the form of MOAs or memorandums of agreement, or drawing on existing statutory protections to restrict the use of screening information, and so that's not used for legal decision making. And without collaboration, oops, if we can go back just for a moment, without collaboration with community providers, integrated screenings will identify needs that cannot be responded to via an appropriately matched referral process. And that final point is that, of course, while screening has become a very routine practice in juvenile justice settings, our experience suggests that the success is based in part on providing adequate training and support to the staff who are conducting the screening. So moving to the next slide. So our first step in structuring the brief intervention has been really to obviously think about that screening component. We've determined what screens are currently being used, if any, and if the screens are providing adequate coverage of recent substance use, mental health problems, and traumatic stress. And through phone meetings and on-site visits, we've reviewed the current screening tools and practices with each of the pilot sites with the goal of ensuring that the screens are evidence-based with specific policies and procedures regarding confidentiality and protection of the screening results. And this has really involved offering a pretty high level of technical assistance on revising current screening procedures to really address gaps and/or outright assistance on developing entirely new screening processes to support Esper. You want to move to the next slide? So here is our sort of current conceptualization of SBIRT in JJ. And so the brief intervention is broadly incorporating a three-step process with guided feedback that is being delivered by the juvenile justice staff who are completing intakes process at each site. It's designed as a single brief, but a time variable session, and consistent with the broad definition of screening in juvenile justice as being based on results that are suggestive of a potential difficulty. Each step will involve sharing the results of the screen, engaging the youth in a conversation about the screening results, and then helping to provide some feedback and to determine a plan for goals and possible referrals. So for step one, of course, this involves the more traditional SBIRT steps of sharing concerns and psychoeducation about substance use and examining their readiness for change. Step two is drawing on a process known as secondary screening that is commonly used with a common mental health screening tool used in juvenile justice settings. Essentially, this involves providing feedback about the specific mental health problems that are being flagged by the tool and some psychoeducation to help normalize that such experiences are actually pretty common among youth who have contact with the juvenile justice system. We're offering scripted questions that will help guide obtaining information about the frequency, duration, and the severity of mental health symptoms post the screen, and the youth's perspective about possible connections between their mental health and substance use are included to help with that integrated component that we're really trying to achieve through SBIRT JJ. And step three is going to take a very similar approach in looking at and reviewing the results of the trauma screen. It's very important for what we found with trauma screens that staff have the opportunity to normalize that traumatic stress symptoms often reflect attempts by youth to cope with their past or their current stressors. And once again, we're looking to make that connection with potential substance use as well, as substance use can really be one coping behavior that youth may be engaging in response to their trauma symptoms. And so we're offering guided questions to elicit an engagement and conversation with the youth about their particular symptoms that they're experiencing to help guide and uncover a possible connection between their current trauma reactions and substance use. Now, our work with the advisory board and sites have really suggested that we're building in an optional step 4 of a broad goal setting in relation to broader behavioral change that could facilitate development of really typical case plan targets that the pilot sites are already doing. But between the particular goal setting and establishing a plan around substance use and the ability to really integrate and reflect goal setting and problem solving rather holistically at the end of a step 4 is really seen as being able to facilitate and build on what a youth identifies as their priority needs, and then how information about a referral, a potential referral for other mental health screening, a referral for substance use services, or possibility of co-occurring services or further trauma assessment can then be added on as part of that final goal setting step. So if we want to move to the next slide. There are a few tools that we have been currently working on to help support the implementation of SBIRT JJ. The first is really looking at training and skill building opportunities for staff. So in order to provide appropriate psychoeducation during the brief intervention, we want to ensure that staff administering SBIRT JJ have some up-to-date information on some of the topics listed here: adolescent development, substance use, mental health, and trauma, as well as very specific training on the scripted guided decision steps for SBIRT JJ and how motivational interviewing and families can be engaged as part of this overall process. And as mentioned earlier, screens do nothing but often identify needs, and it's our experience with juvenile justice that is usually multiple needs that can emerge as well. And then, of course, those needs can then be impacted by the youth family goals and their overall readiness for change. So ultimately, what we are working with systems is to make sure that they have a good resource map, that they have referral resources mapped out in advance to help guide that feedback and referral process at the end of the brief intervention. Ultimately, if you do not have a community partner or agency that can help, that a youth or family can be referred to, the likelihood of the youth or the family having the skills to move forward with their goals is certainly going to be attenuated. And because SBIRT JJ is designed as a brief one-setting intervention, we've recognized that all of our pilot sites need to have this resource mapping done in advance, so when a youth or family leaves the intake center, they have new information about new information that they can access and referrals that they can leave with as well. And the other thing through this integration process is that we know that level of needs that are revealed by the screening should inform a basic triage process, or how urgent the needs are. And so we've offering up a basic decision matrix that maps different levels of the screen that can be integrated with the youth or the family perspective, and that will help the juvenile justice staff to identify and prioritize what type of referral they want to offer up the youth and the family as part of the integrated screening results. So that gives you a very quick overview of the brief intervention, and I'm going to turn it back over to Carly to identify some of our next steps.
Thank you, Keith. We can move on to the next slide, which talks about next steps. So based on that last slide, you can see that there's a lot that there's certainly been a lot that's happened and a lot for us to build on, but there's a lot of opportunity here and a lot that we have to do over the next year with these sites in order to really work with staff to help them develop the skills to be able to implement SBIRT JJ within these settings that we've identified so that we can evaluate it and hopefully be able to take all of the lessons learned and get those out to the field so that other juvenile justice systems and settings and jurisdictions can really take the lessons learned from this and hopefully replicate the work elsewhere. So that first next step is implementation. There is a long list of training and technical assistance that has been and will continue to be provided to the pilot sites that are participating in this project. A lot of those needs were anticipated as part of our initial planning stage for this project, and there were also a lot of needs that we had not anticipated that came up as part of this project as well, which again is why it's been the process that we're using of including an advisory committee, but then also very much working with pilot sites and practitioners has been incredibly influential and helpful in developing this implementation guide because it reflects not only what the literature says and what best practice is as we know it nationally, but also what the real-world challenges are on the ground in juvenile justice settings as well. In order for us to move forward with the evaluation, we have to, move forward with the implementation with all of our pilot sites. In terms of the evaluation itself, we are implementing an evaluation that involves key informant interviews and focus groups with juvenile justice staff. So we really want to know, going into this project, what are some of the challenges and where do they see areas for need in terms of identifying need and responding to need among youth who are coming into contact with the justice system. And we will be reconducting those key informant interviews and focus groups at the end of the pilot project to be able to get feedback from those staff who have actually implemented SBIRT in the justice setting and be able to, again, gather those themes of what the lessons learned are from this project. We will also be collecting administrative data, so looking at the number of youth who were eligible to be screened through this SBIRT project, the number of youth who were actually screened, the number of youth who received that brief intervention, and who also, of course, were referred to treatment. We also very much want to know what the average administration time is, so we will be collecting information on that as well. We will be administering both staff and family satisfaction surveys. So wanting to know very much from staff if this is something that is helpful, if the SBIRT JJ is something that's helpful for them, but also want to know from family members if having this conversation with juvenile justice staff as part of the intake process and then receiving that follow-up referral is something that's helpful. Were they satisfied with it? Was the information provided useful? Is the referral something that they're planning on following up with? And if not, why? And also want to look at training measures. So for the training that is provided, very basic numbers in terms of the number of people who are trained, satisfaction, but also wanting to be able to measure knowledge and skill development as part of this process as well. And then lastly, being able to take all of the information gathered through the implementation process and the evaluation process, revise and make all of the changes necessary to that implementation guide that's going to be piloted based on all of our experiences, and release that hopefully by the end of August of next 2017. So a lot to do, a preview of what's coming in 12 months, but something that's, we've been working on this project for a year and a half now, have learned so much, in particular over the last 6 months with working with the pilot sites, and are really excited about where we're going from here. So with that, Crystal, I don't know if there are any questions.
Hey there, yes, we've had a couple questions from our attendees. I also want to remind everyone that they can submit any questions that they have through the questions box or the chat box. So the first question is, are the sites based on the way the various... I'm sorry, Carly, could you repeat that?
Oh, sorry, I didn't say anything.
Okay. Are the sites based on the way the various juvenile justice systems are organized?
Can you repeat that, Crystal? I'm not sure that I understand what the question is that's being asked.
Absolutely. The sites that you identified earlier in the presentation, the question was, are they based on the way the various juvenile justice systems are organized?
Yes, they are. And one of the reasons that we are working in a number of different states, not just settings, but states as well, is we did not want to pilot test this SBIRT model or framework in any one particular jurisdiction or state, knowing that some states operate a little differently than others. So we have identified a number of sites in a number of different states, and we've tried to be, with the exception of the courts, we've actually tried to identify multiple sites to work with and that represent different intervention points. So for example, the initial contact intervention point, we're working with a site in Minneapolis, Minnesota, and we're working with a site in Calcasieu Parish as well, that both represent that intervention point. So hopefully the findings from the evaluation and from the implementation experience will not be unique to a state or any one particular setting, because we will account for that by working with multiple settings in multiple states.
Perfect. The next question is, can you talk about implementation considerations for addressing trauma and the possible relationship in substance use in cases where the trauma is acute in a 15-minute intervention?
Keith, that sounds like a great question for you.
Sure. That's a very good question. And of course, the approach here is that we are not, of course, going to be thinking about this as being able to provide or teach any particular pattern of immediate coping skills. or to provide some sort of immediate relief to an acute trauma reaction or to an ongoing trauma. It basically is thinking about what can be revealed through a trauma screen process, and we're training the staff to really think about that screening can only suggest the possibility of that a youth has acknowledging prior traumatic event exposures and that they may be currently suffering from current trauma reactions. And it's not meant to be a diagnostic process, and ultimately the way that trauma screening is set up for juvenile justice is to flag youth where there is enough of a concern about current trauma reactions that they should be considered for a potential referral for a more comprehensive trauma assessment. So our goal is to really keep the intervention component of reviewing the screening results guided by that basic principle. We do think, however, that there is an opportunity to provide some basic psychoeducation about a dysregulated stress response. This will not be, and this will be as a way to help youth maybe gain a slightly different perspective about why they may be currently thinking or feeling the way that they are. We do not anticipate that this is going to provide much symptom relief by itself and or introduce current coping skills. That's well beyond what we would expect to happen in a 15-minute conversation about what the trauma screen is suggesting.
Thank you, Keith. Another question that we've had is, how is actual SBIRT JJ training conducted? How much role play practice is built into the training?
So the training is being provided in a number of ways. It's being rolled out with, or it will be rolled out with a number of virtual web-based presentations on things such as adolescent development and substance use and mental health, basically mental health 101. This was one of the areas where I don't think that we anticipated needing to provide more training around motivational interviewing or more of the skill building piece that was just mentioned in the question. And what we heard from the pilot sites is that they actually, their staff needed or would like to receive more training or more information basically around the fundamentals. So again, the adolescent development, mental health 101, substance use, in particular around what substances youth are using and what the implications are for that use. And then also techniques around family engagement and involvement. So a lot of the training is being provided virtually in terms of the informational portion of the training, and then we are providing for those very targeted training needs, those skill building needs, we will be providing in-person training, and that's something that we are working with each of the pilot sites through an assessment process to identify exactly what their staff training needs are, and we will provide that specific training to those sites.
Perfect. Was there any feedback from the initial pilot training?
That is ongoing. So to date, we have worked with we have conducted initial site visits. We've done baseline data collection with each of the sites. We have reviewed the pilot implementation guide. We've identified current practice around screening and workforce and community resource mapping. So we have done all of the foundational work with all of the sites, and we'll be moving forward with the implementation in the months to come. So stay tuned.
Great. Was there a reason that the focus is on one SBIRT brief intervention versus multiple brief interventions?
That is a great question. And yes, there was. So the advisory committee really recommended that we focus on those earliest points of contact, pre-adjudication. So very often, especially when we're talking about those initial contact points like those juvenile assessment centers, or we're talking about the probation intake departments or diversion departments, depending on what the charges are and what brought the youth into contact with the juvenile justice system. Very often for those initial settings, or in many cases, there will only be one contact with youth and families. So we wanted to create an SBIRT JJ that could be implemented in all of those settings where the JJ staff would only see youth and family one time and would very often only have an hour or two with those youth and families. There are, of course, opportunities for expansion if the youth and families will be seen by practitioners more than once, or those juvenile justice staff more than once. There are, of course, opportunities to expand on this, but we really wanted to create a framework or a baseline for all of those initial contact points where youth and families would only be seen one time.
Carly, could I add something to that as well?
Oh, please.
It's a very excellent question, and juvenile justice sites, just to tag on to what Carly was mentioning, many number of the sites are essentially a one session, one stop, 1 to 2 hour contact, and that is primarily done by non-clinically trained staff. And so we're building on those screening processes and procedures that we know have been successful with non-clinically trained staff in other juvenile justice settings. However, a few of the sites have clinicians on site that conduct the intake process, and then we'll have the option of developing a more comprehensive case plan over 1 or 2 sessions. I think the goal of this overall process is not to determine whether the single session or multiple sessions is more successful, but we want to just learn from the different experiences between the sites that will help us to understand what may be more feasible associated with different outcomes, because it gets a little complicated between the different types of staff that are available at the facilities and how this maps onto their existing case planning and referral process.
Perfect. So we've had quite a few questions come in about the screening tools that you're using at these sites. Which screening tools are you using, and are they tailored specifically for adolescents to screen for mental health, substance use, and traumatic stress?
That's another excellent question. Keith, I'll start, and then if you want to jump in.
Sure.
So we have identified a number of screening tools that have a research base for use of adolescents and a research base for use in juvenile justice settings. So we looked at all of the screening tools that were available, and we applied those filters and actually have a number of tools that we are recommending. The other thing that I would reference or mention again is that screening isn't new in juvenile justice settings. Many of the sites are currently screening for something, maybe not all 3, not substance use, mental health, and traumatic stress, but they are certainly screening for very often mental health in addition to risk, or sometimes also traumatic stress as well. And so what we didn't want to do was go into all of these pilot sites and say, here's a tool that you need to use, and we're going to replace what you're currently doing, because in terms of thinking about further dissemination of this model, we didn't really think that that would be a best practice and something that would be could easily be replicated. So we wanted to take into account that juvenile justice systems were screening for something, identify what tools had a research foundation or a research base for not only use with adolescents but also in juvenile justice settings, and that would screen for mental health, substance use, and trauma. And then we are working with all of the sites to identify where their gaps are and which tools would best fill those gaps based on what they're currently using as well. Keith, I don't know if you want to talk any more about the
Sure,
process.
Yeah, and Carly summarized the process of screening very well. And the main criteria that we are promoting is to not control tools, because as Carly mentioned, many sites already were screening for one or more of the 3 content areas. But our criteria are that the screening tool has to have some research evidence, has to be validated for use with adolescent populations, and has to have some research evidence for application to juvenile justice settings as well. And so we've really maintained the standards that have been outlined in, for example, the screening and implementation guides that are at the beginning of the slides. And there are many websites that will describe a lot of these different tools that meet those criteria. I can just mention a few of them that we know that sites are utilizing, because I think the question was about specific tools as well. So for substance use, the CRAFT is quite commonly used. And that's one of the tools that we have been recommending. Oftentimes that's augmented by a review of substance use needs that are integrated into broader risk needs assessments that are being done by some of the sites as well. Maybe like the Youth Level of Service Case Management Inventory, or the YASI is another example of those tools. The most common and most well-known mental health screen in the juvenile justice system is the Massachusetts Youth Screening Instrument, or what's known as the MASI-2. It provides a very quick and efficient way to screen for a number of different mental health areas, including lifetime traumatic event exposure. In the trauma area, there are 2 tools that we are commonly recommending. One is a tool that I've assisted in some work on developing, or its application to juvenile justice. It's known as the STRESS, the Structured Trauma-Related Experiences and Symptoms Screen. Another is a screen that has been developed and it's going through some ongoing validation in the state of Connecticut. It's referred to as the Connecticut Trauma Screen. Other sites, and for those of you familiar with trauma screening, you may be familiar with the UCLA PTSD Reaction Index. That is another screen that is a bit more comprehensive in terms of its application. And that's another tool that some sites have expressed some interest in as well. I will note that trauma screening is relatively new in terms of its specific application to juvenile justice. There's been a widespread interest in it, and the research evidence around the particular application of decision rules that are really set up to support screening for trauma are a bit more complicated and complex compared to other decision rules developed for substance use and mental health. So this has really impacted the level of technical assistance or consultation that we've been offering to sites about how best to utilize a trauma screen.
Thank you so much, Keith and Carly. I can see that we're getting to the end of our time together today. There are a couple more questions, but I will send those out to you following the presentation so that you are able to answer them, and I will send those out to the attendees. I want to thank everybody for their great questions and participation today, and I want to thank Keith and Carly for such a great learning community presentation. At this time, I'd like to go over our evaluation and CEU instructions. You will receive a few emails from us following this webinar. In these emails, there will be a link to the recording of the webinar, as well as a PDF version of Carly and Keith's slides. Also included in the email is a link to the evaluation. Our grant evaluators are required and pleased to collect feedback from all event participants. Completion of this evaluation is critical to maintaining our funding and continuing to provide quality education and materials. Your participation is appreciated, and the evaluation should take no more than 2 minutes of your time. Immediately following the evaluation is a request form for a certificate of attendance or NADAC and PCB CEUs. Should you choose to skip the evaluation, proceed directly to the CEU request page, leave all the answers blank on the evaluation. Again, we'd like to thank you for your participation today, and if you have any questions at all, please email us at info@ireta.org, and we'll be sure to follow up with you as soon as we can.